Welcome to INSEAD Perspectives, Spotlight on Asia podcast. I am Hasija, Dean of Asia at INSEAD, the business school for the world. In this series, I have the pleasure of speaking with INSEAD faculty, as well as with leading decision makers from across the region and industry sectors. Together, we explore some of the most pressing issues shaping business and society today, all through the lens of Asia. In this episode, I am joined by INSEAD alumna Dr. Suhina Singh. Suhina is the founder of Jonda Health, a Singapore-based startup that utilizes AI to make healthcare data more accessible and useful for practitioners and individuals. Suhina, thank you for joining us.
Thank you so much for having me. I'm really excited to be here.
Now, I want to go straight into the sector that you are a part of, which is healthcare. It's big. We know it has huge impact, both economically. I mean, if I'm not wrong, even this year, it's about a little more than $8 trillion globally. And just in Asia, it's a little more than $4 trillion. But more importantly, it has huge social implications. I mean, it's a super important sector for all of us. So what I want to hear from you as we get started in this conversation is, where do you think is the biggest opportunity in healthcare?
Great question. I think the opportunity is all across the board, actually, and I think the opportunity is really AI in healthcare. So an interesting statistic that I actually found is that $37 billion was spent in 2025 just on the AI in healthcare market, which is pretty significant. And I think what's even more interesting is that's actually growing 40% year on year, which is also really fascinating. So really that adoption of AI in healthcare is really rising. Another interesting fact that I found was that by 2030, the share of healthcare that AI actually touches is expected to roughly double from like 15% what it is today to like over 30. Oh, wow. So that's huge. And I think when we're talking about where in healthcare, I always like to look at the continuum of care. So when I look at the continuum of care, I would say when we look at drug research and discovery, there's so many amazing things happening there because all of a sudden you're having drugs come to market, all that research, the time that it used to take years and years and years is coming to months in terms of really identifying different targets, etc. So phenomenal space. The second one I would say is diagnostics. 70% of like whatever we do in healthcare is really on diagnosis because without that you can't really go anywhere else. And what's really fascinating in that space on the diagnostic side is you're starting to see greater use of AI, especially when you're looking at radiology. And so there's some really interesting projects actually that have come up in the radiology space, detecting things like tuberculosis, for example. So there's a really interesting startup actually that's based out of India called Cure.ai. And they do some really fascinating stuff. And they've done a really interesting project. And this is really interesting because they were able to detect TB on x-rays of people which were not diagnosed before. So all of a sudden, you have a healthcare system. They're able to pick up TB more rampantly than they could before, but is the system be able to handle the fact that they've now picked up all of these new cases? It's an interesting dilemma to have, but a fascinating one nonetheless. So I think diagnostics is amazing because it allows us to really get to earlier treatment potentially, which is great. On the treatment side, I think it's so exciting what can be done with AI because clinical decision support systems are no longer just like a notification. Mm-hmm. They can actually leverage the data and be able to inform physicians with evidence-based care as to what would make the most sense in the context of that patient, which one fundamentally changes the game. Because when I was practicing as a clinician, which is a very long time ago, but when I was, you really are relying on a lot of the information that you're taking in from the patient. You don't have the bandwidth all the time to look at all the historical data or what's happened because you maybe have just 10, 15 minutes with the patient. That's very, very challenging. But if you can start to see the trends and everything else, it's amazing. As a physician that used to work in oncology, it's changes the game in such a big, big way. And I think that's very, very exciting. And I think the other part, which I'm very excited about, is really the clinical and patient workflows as well. So on the clinician side as well, what we're starting to see is also a rise in ambient AI So a lot of the medical scribes. And when I speak to my friends who are doctors, they get so excited because, and I can see why, because it really reduces the cognitive load and they can actually spend the time connecting with the patient without needing to worry, hey, is everything being captured, and having everything already structured in a way that they can just check and like submit into the EHR. It makes it a lot more effortless. Also, when we're looking at the EHR, so I'll just mention that that's electronic health record system for those that are not familiar, or a clinic management system. So it's basically the IT platform that everyone is using. Those then themselves are becoming more intelligent, which is really incredible because one of the pet hates of every physician is needing to like manually input data everywhere or click here, click there. But I think we all have that experience with every piece of technology that we use. And so I think, AI is really changing that game, and we're starting to see the emergence of really what we call intelligent electronic health record systems and clinic management systems where you can speak to it and it can actually do just about everything for you, give you an update on like what's happened with the patient, for example. So if you come in, I could just say, ask the AI to say, hey, please let me know like a short summary on like Samir as to what's been happening to him over the last couple of years since I've been seeing him. And you can get a summary. And then you can drill down.
And let me just pick on this a little bit because I have done some research in healthcare myself. And I studied flu vaccines, looked at stem cells versus, stem cells coming from cord blood versus bone marrow, or looking at patient flow through hospitals and kind of open access systems versus, reserved systems. In all the themes of research, which are somewhat kind of varied in different parts of healthcare, the primary thing that ultimately I was looking at was a cost-quality trade-off and trying to figure out what is the right sweet spot. And what I hear from you, which is fascinating, is that the biggest opportunity that we are facing is that the biggest challenge of healthcare, which is the cost-quality trade-off, may actually be attenuated, if not eliminated, using technology. Because what you're telling me about AI is not only improving the cost side because of the shortening of the time or saving the time of the doctor, which all has implications on the cost, but actually huge implications on better outcomes in terms of more personalized medicine, in terms of finding diagnoses which otherwise would be missed by the human eye, et cetera, et cetera. So that's pretty fascinating because I can tell you there's just so much attention paid on this trade-off, and getting rid of this trade-off, or maybe not rid, but at least attenuating it, can have huge implications. The other thing that I'm picking up is it's all across the value chain. I mean, from everything that you described, it's at the patient flow level, it's at the patient care level, at the front end, it's at the R&D level, it's at the records level, and making sure it's a seamless flow of things. I mean, that's quite fascinating. So this is quite remarkable. Since you are in Singapore and you've been here for quite a while, and you talked with so much excitement about technology in healthcare, which I think is wonderful to hear. Can you zoom in a little bit on Asia and tell me, is there a lot of attention on technology in solving such challenges in Asia?
So let me talk a little bit about like Singapore and what we're seeing in Singapore as well. And I think there's a huge adoption of like AI in healthcare where everyone's trying to do something. And we'll see that in some of the government initiatives that are actually being laid out within the healthcare space. I mean, Singapore itself, they have their own AI scribe that over 2,000 healthcare providers already use today in Singapore.
Oh, wow.
So, I mean, I think it's becoming a part of everyday life. In terms of adoption, I think there's a huge push towards adoption in Asia as a whole, and I think that's multifaceted. The first one really being around the demographics itself. So the first one, everyone's getting old.
Right.
And so when we look at like North Asia, it's actually growing the oldest in the whole world. So you have that happening on the one end, but then you have other markets in Asia where actually it's a very young demographic. So it's two very, very different sides of the coin. So if I focus in on the older demographic and what that's asking for, right? there's more reliance on the healthcare system, which means there's more burden on the healthcare system, which means that needs to be more efficient. Like we talked about the whole cost quality thing, because it becomes a really significant problem. So there's some really interesting statistics with regards to that as well when we look at what that economic weight is actually on a particular economy. So there is one data point that I found that was also really interesting. So the cost of chronic conditions over 2010 to 2030 for China alone was $7.7 trillion. Wow. Which is wild.
Which is wild, yeah.
And guess what? Only going to grow unless, of course, we adopt AI. And I think this is also why, like in this region, there's really this push towards how do we address this? Otherwise, we're going to have a serious problem at the end of the day. Looking at the other side of the demographic, you're having an emerging middle class as well. And the younger demographic, the way they want to interact with healthcare is very different. And so I know a lot in the US, they talk about this consumerization of healthcare. Mm-hmm. And you're starting to see that in the younger demographic here already, where they actually want healthcare to be efficient. They want it to be digital first. They want to engage with healthcare very differently. Mm. So that, I think, is also driving the adoption. The other thing is that maybe not too dissimilar from other parts of the world, but there's a lot of rural areas and inaccessibility as well within Asia, right? And so when you want to start to address some of those pockets, a really great way to do that is starting to leverage technology. And there's some really great companies actually that are working in that space, that are innovating in that space and saying, hey, how can we make use of community workers and technology so people in the rural areas also get access to specialist care? And that's not just for the urban areas and for people that are concentrated in the city, because more often than not, the specialists don't want to go to the rural areas. They want to stay in the urban areas. I was one of those as well. I didn't want to go into the rural areas. I wanted to stay in the city. But it's a real challenge, right? And I think compounding that challenge as well in this part of the world is there was a statistic by WHO that actually says that in India, for example, there's going to be a massive shortage of clinicians in certain markets, because then there's a demand-supply issue. And even if there is enough doctors, well, then if the population keeps rising and they're getting older so fast, then there's once again demand-supply issue. And I think this is where AI is really helpful. And I think this really helps with the adoption of AI, particularly in this region.
And do you see that kind of equal access slowly happening? I guess what I'm going with this is, again, staying in Asia, are the investments and the focus more on the developed part of Asia, like Korea, Japan, Singapore, or are you seeing movements in other parts of Asia which are still struggling, still developing, and access to healthcare, as you yourself pointed out, is not necessarily easy? Take rural Indonesia, for example, rural India, for example, Bangladesh, for example. Are you seeing a concentrated effort there? Do you think something is happening, or is this just a promise out there that is yet to be realized?
That's a great question. I would say it's a mixed bag. I think the challenge is that there's always this sort of tension because, as much as people want to be able to address a lot of the challenges and really address health access, et cetera, and us included with what we're doing, right? We want to be able to make what we're doing accessible to everyone. At the same time, there becomes a cost challenge when you start going into the rural areas, right? And so the question is, how can we still innovate while keeping that cost down and really taking a very frugal approach to innovation? Which sometimes becomes quite challenging because I think, I experience this myself, and I'm guilty of doing it myself. Even when I'm using like Claude Code, for example, sometimes I'm taking a bazooka to something that just really doesn't require a bazooka. So it's just being very mindful of like also how we're innovating in the space so that we can actually keep costs down, because we don't need to throw AI at everything. Mm-hmm. And I think there's this tendency to do that. But I think what's not really maybe supporting as much this innovation in some of the rural areas is the access to funding being a big one. Because there's always this tension because healthcare sometimes just takes a little bit longer. Mm-hmm. And sometimes that realization of value, yes, it's realized to the patient, but that commercial realization of value is a really, really tough case. And when I've spoken to other innovators that are innovating in that space, it really is a trade-off because, one of the entrepreneurs I spoke to, he told me, there's a part, if you look at the pyramid, he goes, there's some part that you really still can't even touch because it doesn't make economic sense. And that sounds terrible to say because it's people's lives and it's people's health, right?
Right.
And health for me is a fundamental right, but it still becomes very challenging to address every single layer. I'm not saying it's not possible.
Yeah, but from everything that you've said so far, what I gather is that we have the best chance now.
Yes.
And do you feel that there is state support or government support pushing this and helping in some way to increase the adoption, to increase the penetration, to increase the spread and the reach that healthcare can provide to areas which otherwise are very hard to reach? Any state push in this, in your observation?
Yeah, I think, governments are doing a number of different things, whether it's providing more access. So Indonesia, for example, is a really interesting example. I mean, before they didn't even have a national insurance, and now they do, which is great. But when we're talking about like innovating in healthcare in and of itself and sort of that spread, some of the stuff that I've seen has been more in the more developed markets, to be honest, Samir, and not really about like how do we really sort of cater towards the peripheries or the more rural areas. That I think we're starting to see more of the foundations get involved. There's more grant activity, which is amazing. I think there always has been. And I think that's getting more focus now, which is amazing. But if I circle back to what's happening in the more developed markets within Asia, so there's a lot of different incentives. So in Singapore, for example, Synapse, which is basically the health IT body for like Singapore. So everything that gets done in Singapore is through Synapse. And so there is a platform called Helix, where all the data is gathered in Singapore, and all the health clusters have the ability to leverage that data. And they can train and build their own models, which is amazing, right? Which is great. Korea, for example, what they've done is that they've actually made their data available in part to digital health startups or to startups, and actually pay the startups to be able to leverage the data. So it's quite an interesting voucher-based thing that they've done to once again promote sort of innovation in the space, because you can't do anything without the data, especially if you're doing stuff in AI.
Right.
It becomes pretty challenging. Other things, for example, there's a lot of grants that are available also like from the government sector to help even smaller enterprises, even if it's clinics, etc., to start to embed some innovation into their practices, into their clinics. Singapore also has stuff for like the training of like the healthcare workers in AI. So I think there's a lot of activities around the board. But when we first asking me specifically about in the rural areas and addressing some of those rural, harder to address areas, it's a good question. I haven't really seen that much from what I have seen, but there might be stuff that I have not come across.
Fair enough. And I'm still very happy to hear this. And the reason I say that is healthcare is a delicate field. Innovation here has to be done a little bit more carefully. This is not the same as building an app, right? Every mistake here counts. And so if there is a push, there needs to be a push. So I'm not surprised that the starting point is coming from these pockets of the more developed part of Asia. And that's very interesting. And that, to me, is a very nice segue into your journey. I mean, I know you are a clinician. I mean, you were a clinician. You practiced medicine for a long time. You moved into the business world, and now you've been, you started this startup in the healthcare world. Can you tell us a little bit more about what you do, and using your experience specific to healthcare? And I know you deal a lot with technology in the way you're trying to innovate in the healthcare space. What are some of the challenges that you face? I mean, again, healthcare is a delicate space. There's a lot of regulatory burden, there's a lot of responsibility, and so things need to be done quite properly. So I'd love to hear, what did you start? How what are the challenges you're facing? And more importantly, how are you trying to navigate that?
So let me start with the beginning of my journey, because when I started the company, my whole premise was like, because I was suffering from a number of autoimmune conditions, and I just wanted to have all my health data in a single place because I was going everywhere, and I was just like, oh my gosh, it's very frustrating. As a doctor, I don't even know what's going on with me, and that's seriously concerning. And so I said, there must be a way for me to bring all of this together. So we started developing a patient-facing application, which was the first product that we built. And as we started to build that, Samira, we started to realize something very interesting. We were like, we knew the health data was bad. And I mean, I come from healthcare. The CTO at the time also came from healthcare. But I don't think we appreciated how bad was. I mean, I probably thought it was, it's probably around here, but it was like, the depth of the problem was clearly a lot bigger than what I gave it credit for. In some ways, probably that's a good thing. Mm-hmm. Ignorance sometimes is bliss. Mm-hmm. Otherwise, we wouldn't have gone down the path. At the same time, as we were doing that, what we started to realize is, as we've started to realize that, hey, this data problem is really, really huge, what we were trying to build with that patient-facing application was we were trying to build in very intelligent care when it came to certain predictive algorithms, it being able to do certain nudges, etc. But it actually required the data to be usable. Mm-hmm. And we indirectly were building a health data transformation engine, which we now call Jonda X. And so I like to call it a travel adapter and translator for health data. So it can plug into any system. So it doesn't matter where the source of the data is and which format or which terminology it's coming in. It can be transformed and converted into something that is structured, that's interoperable and AI ready for whoever needs to receive that data or leverage that data. Mm. So we cut out all of that heavy lifting for anyone that's trying to innovate in the space. So that's where we landed up, and that's Jonda X today. So really dealing with the data layer, and we're trying to be that health data layer because I think we really can't move forward. So all the cool things that we talk about all actually require data. Right. We don't solve that, we have a problem.
Right.
Solving data comes with its own set of challenges. Once again, we need to be able to deal with a lot of edge cases. We build with large language models. So when I say we build with large language models, I mean there's large language models in the product itself, and we also code with large language models as well. Mm. And all of these things bring in their own sets of complexities, as you can imagine. So I'll go with having the large language model in the product itself. So when we're dealing with that, one of the things we've needed to innovate for is ensuring that no personal identifiable information is actually going into the large language models when we're doing the processing. Mm-hmm. The other part is that the large language model can't handle everything on its own. So you can't just say, that is my tech stack. It doesn't, I wish it worked that way. It would make my life so much easier, but mm-hmm. It doesn't. There needs to be checks and balances in place, and you need to use appropriate technology to solve the appropriate problem. The large language models, the challenge is just like when we're dealing with ChatGPT or Claude or whatever it is, hallucinations are a big issue. Mm-hmm. And so that's one thing that we need to ensure, that it's not making up data. And in the very early days, we faced challenges where it was making up data. It was creating its own blood biomarkers, its own results. And we're like, that is challenging.
Be very careful there, yeah.
Exactly. The other thing is reproducibility. It becomes really important because you want to know that you're passing the same test through. I'm passing it through 10 times or 100 times, and I'm always going to get the same output, which is really important.
Really important, yeah.
So that's something else that we need to manage. So the whole quality control process is really important. And then the data itself, where the data gets processed, where the data gets stored, that's all something that we need to look at based on the different locations of wherever that data is, and can it be transferred somewhere? Where does it need to be? So these are all the complexities that come, and the importance of actually building a system, mm-hmm. and not just yeah, we're going to use a large language model and we're done. I wish it was that easy. When it comes to coding with a large language model, that also requires like checks and balances. So we've needed to put in checks and balances as well when we're actually using AI as well to code, because even though we do have a QA process, some things still fall through. I mean, it happens. So really having a system in order to be able to address some of these things, I think, is really key.
Yeah, and I'm glad you articulated this, because to me, the technology it's a means to an end, and blindly jumping on it is always a problem that I see, and many organizations do that, and they go back and say, hold on a minute, we're not getting the intended gains that we wanted. And again, we are very tough on technology, because when humans make mistake, we still carry on. But if technology makes a mistake, that's the end of it. But that is a good thing, and I think putting those checks and balances in place are an extremely good thing. So from what you described to me, you started off as a front-end patient-facing kind of system, but it seems that the real value sitting in what you're trying to do will be for clinicians and hospitals and even national healthcare systems. Isn't that right?
No, correct. So for clinicians, for patients as well, to be honest, right? Because I know for myself, like trying to have my data scattered everywhere. And I mean, you already have a chronic, if you have a chronic condition and you already feel not great, and now you have the additional administrative burden and stress because you can't trust that your doctor knows everything about you. That's not healthcare. So you already have like mental health issues of the patient coming in to see the doctor because I can't trust the doctor because he doesn't know everything about me, right? I think even on the patient side, it makes a huge difference. I think on the research side, I think there is so much as well, because on the research side, what we've seen, and I actually didn't fully appreciate either, is when we're looking at clinic research organizations, when the data is coming in from the different labs, etc., everyone has their own format, everyone has their own standards, everyone has their own terminology, and when you're trying to get the data back in, you're just spending months, and that data reconciliation process just takes a very long time, when if you could actually leverage AI, you could actually really reduce that, which is great, because then you're actually reducing also the cost of R&D as well, which is amazing. So I think data sort of permeates through all aspects of healthcare, which is great, which is why I love what we do, because it touches everyone.
No, and listen, I always feel that we are very data rich, but very information poor. And the reason for that is that data is everywhere, but it is hardly put together in a usable format. It's sitting in silos in different parts of the organization, or even our life. And having it all put together to start then making sense out of it is a necessary, it's not a sufficient condition, but it's a necessary condition to convert data into information which is actionable, and something can be done about it. So I think it's a very critical problem that you're trying to solve. So where do you see the next steps for you, and as you're moving this forward and really trying to create this smart, efficient way to consolidate data, to bring it together, to make it actionable and insightful, be it for a patient, be it for a clinician, or be it for an R&D lab, or be it for a national health system, or whatever it is? Where do you see the next evolution of what you're trying to do?
Yeah, so the next evolution for us is actually not too far away, to be honest. So for the data transformation engine, we're really trying to be that universal health data transformation engine. But for us, is actually Jonda X really moving towards being an agent that does a complex task. So I think we're moving very much into the world of agentic, where we're going to have a lot of orchestrator agents. And orchestrator agents are going to be calling on other agents to do complex tasks. That means Jonda X would be one of those complex agents to do a specific task that the orchestrator agent can just orchestrate, right, without having to do everything itself. So I think you're going to start to see people having more niche, very niche agents doing very, very specific things and that are really, really good at it. So yeah, that's what I think is the future, and that's the next direction for Jonda X or Jonda Health. which I think is very exciting. The other thing that I find really interesting, which is also why we want to move Jonda X towards this being a complex agent and also having our MCP as well, is because people are also starting to build their own stuff. Because you've also built your own stuff, right? And I'm also building my own things. So we want them to be able to build their own things as well. So if they actually require the functionality, they can use it as well. So in some ways, that line of B2B, B2C kind of gets a little bit blurred because people are also building their own solutions for their own needs and their own requirements. So I don't know, it's an interesting space.
No, it's very interesting. And funnily enough, even in our courses here, in our training here, both in our degree program as well as executive education, you can see that the nature of conversations we are having with folks that come to our corridors, how we think about building systems, how we think about management, how we think about, what does it mean to create value, all those conversations are changing and rapidly evolving because people are very interested in what the world will look like when we go forward, right? So there'll be senior executives coming into our programs, and we will get their hands dirty with one of these AI technologies and say, well, let's think about what this can do for you, which is different, right? And it's quite exciting. And I also, for the benefit of our audience, and I think it's very important that people who are not in healthcare still, in my opinion, focus and look at healthcare and see how technology can and fundamentally shift how things can be done here in terms of how value is created and how value is captured. Because if a complex system, which has so many moving parts like healthcare, really benefit from technology, I cannot imagine another industry that cannot benefit equally, if sometimes even more, because perhaps the complexity is less than healthcare. So it's independent of the sector that our audience is a part of. I really think zooming in on healthcare can give a lot of examples and motivation and inspiration for them to then go back and port that thinking back into their world and see what can they do about it. So at least as you were explaining many of these things, I realized that much of the learnings that you have and the experience you're sharing is portable to almost every sector that one can think about. So very valuable in that sense. And now that I've mentioned how important healthcare is for everybody, independent of whether they are in healthcare or not, what do you think is the future of healthcare 10 years from now? Like, do you have a vision of it? And I know it's asking a lot to predict what it may look like, but maybe you have an aspirational vision of what it should look like, or would you like to share that with us?
Yeah, so I think hopefully I pray and hope that in 10 years from now, we're really dealing with whole person care. And what do I mean by that? I mean that like everyone has a digital health twin. Everyone actually, has all the data on them. The physicians actually know what's happening with the patient, that we've really reduced that friction. And so for me, when I think of things, I think of it in terms of experiences, Samir. So I think if a patient walking into an office, not having to carry a stack of papers with them or like stressing and trying to message another doctor, oh my gosh, sorry, I need to get these mammogram results, like all of that just gone. Stepping in, people already know that you've arrived. You know that the doctor has everything that they need, that's required. You know that you're in good hands. You know that when you're seeing the doctor, that the doctor's actually making eye-to-eye contact with you, is actually seeing you as a whole person, not just from a physical standpoint, but from a mental health standpoint. So we have mind, body, spirit that's actually looking at you more holistically, that you have that support with you 24/7. So having like these personal health concierges or companions, as I like to call it, that's always with you on your phone. So you have this health AI companion that's with you. You're having very informed conversations with the doctors. You're presented with opportunities. The doctors, on the doctor's side, they don't need to worry about like, let me go read through the file, whatever. They already know because they've gotten a summary. They can already see the trends. They're not doing guesswork. They're really sort of like being able to take in, put things into context. So I see a very frictionless health system in my personal opinion. And I think that makes for great quality healthcare across the board, even for someone that's in a rural area, just being able to have that like efficiency, even with some really basic tools. I don't know, I find the whole space incredibly exciting. So I would say that we'd have a more frictionless healthcare system. Experiences are going to be better. You know, when experiences are better and people feel better, their health improves.
Right. Even the
So
need goes down.
yeah, no, because it's an expansive thing. If people feel seen, people feel met, and people are not having to deal with this unnecessary friction, that in itself is healing.
Right. No, I'm glad I asked you this question, and I'll tell you why. I mean, I just mentioned how important it is to follow healthcare no matter what sector you are in. And then I asked you to paint this vision of the future. And sitting here, as you were painting your vision, I couldn't help but think, but that should be the vision in education as well. The market segment of one. I mean, we need to personalize learning, and everybody has their own individual learning. And just learning how you are thinking about what healthcare can mean, I can start thinking about any other sector where the ultimate customer centricity kicks in, which is enabled by technology, because everybody out there talks about customer centricity, but it's not clear to me that we have put that concept of centricity in reality. And the biggest promise that technology gives in healthcare, and by looking at you in every other sector, is the ability to really genuinely be customer centric and cater to the exact needs of every individual we are dealing with. That's your vision for healthcare, and to be honest, that would be our vision in education. So this has been fantastic, Suhina. Thank you very much.
My pleasure.